Hey, welcome. Today we're going to discuss your first post-op visit after knee replacement surgery, typically about 10 to 14 days from surgery. And if you're at that point right now, 10 to 14 days from surgery, I really hope we're still friends. I mean, nothing tests a relationship between a patient and a doctor more than that first week after a knee replacement surgery. But you should know, you've just been through the hardest portion of the most difficult recovery of any surgery that I do. And so that's a lot to be proud of. You've come a long way, but you're still not recovered yet, right? You still got a long way to go. This video is going to discuss what you should expect at this stage, 10 to 14 days from surgery, and what to expect in the weeks and months to come. Stay tuned. Hey, welcome back. I'm Dr. Dan Tomaszewski, orthopedic surgeon at the Door Orthopedic Center at Door County Medical Center. And again, today we're going to discuss your first post-op visit after knee replacement surgery. And where I like to start is just by looking at your knee. Just look at it. What does it look like right now? If you're the average person, it is very swollen. If you compare your operative knee to your non-operative knee, it's much bigger. In addition, if you touch it, it's warm to the touch. Your scar is still a little raw and red. You may be bruised anywhere from your hip to your toes. All of those things are normal at 10 to 14 days after surgery. That's to be expected. Now, at this point, your wound, the incision, should be healed. You shouldn't have any drainage from that wound anymore. If that's the case, you don't need a dressing anymore. We can take that off and leave it off forever. And water can go right over that incision. Now, you should have steri strips or butterfly band-aids going across the incision. Those can get wet. Just don't pick at them. They'll fall off in time. Just let them be. If you have any drainage, though, we'll discuss exactly what to do at this point. Now, that's the outward appearance of your knee. But how should it feel? Should it be comfortable at 10 to 14 days after surgery? And unfortunately, the answer to that is absolutely not. This is going to hurt to some degree for a couple of months, and you're early on in the recovery process. But it shouldn't be that intense pain that you experienced 3 days, 4 days after surgery. It should be getting better. Now, of course, you'll have good days and bad days, and good hours and bad hours. That's normal. Don't worry about that. If you're on your feet a lot, or if you had an exceptionally aggressive physical therapy session, it's going to hurt a little bit more. That's normal. But we should be beyond the point of needing those heavy narcotic pain medications by and large. Again, remember, those medications like hydrocodone or oxycodone, those are specifically for intense, uncontrolled pain that's not managed by other means, whether it be ice or lesser medications. And so by and large, we should be away from those because you're really not hurting like you were, if you really think about it, a week ago. That was really intense. This shouldn't be quite that bad. Now, you'll still have pain as I expressed, and you'll have pain at night and difficulty sleeping. That's all normal. But remember, those medications are not sleep aids. They're not designed to help you get to sleep. Never take them for that. And never take them for 3 or 4 or 5 out of 10 pain. It's only for intense 8, 9, 10 out of 10 pain that you can't manage with other medications. We never take it in case it might hurt in an hour or we're worried that the pain is going to be coming. It's only for intense uncontrolled pain. Okay, I think we got that covered. Now, in addition to the pain, it should feel stiff. Man, getting up out of a chair, that can be a challenge. Those first few steps, it's really got to get working to get moving. But we should be at a milestone marker. Your knee should be able to bend at least 90 degrees at this stage, at this appointment. If it doesn't, you're a little behind with your physical therapy. That's okay. We'll discuss that at this visit if that's you. But no, if that's you, whatever you've done with physical therapy, whatever you've done with your home exercises, we got to do more. You're behind, and we don't want you to fall too much farther behind. We have to push it. Now, if you've met that 90-degree milestone, that's great. We're going to keep going with our physical therapy and our home exercises. But if you haven't met it, we're going to be seeing you a little bit more frequently to make sure that you catch back up to where you should be. Now, what about strength? At this point, your knee should still be weak. Remember, right after surgery, you were using a walker, right? For every step, essentially, because it felt weak. You didn't know that you could trust it. But at this stage, if you weren't using a cane or a walker before surgery, we should largely be away from the walker. We should be using a cane primarily at this stage for short distances or in and around the house, things like that. The more you depend on a walker, the longer your recovery is going to take because your knee really isn't being put to the test like it would be with a cane or eventually without an assistive device. Now, of course, you want to work with your physical therapist on that. And if you were using a cane or walker before surgery, that kind of changes things a little bit. You might need it for other reasons, whether it be balance or a bad joint on the other side or whatever it might be. Now, moving forward in the weeks to come, day by day, you're going to get stronger. That swelling is going to get a little bit better. You're going to get a little more and more comfortable. But that's a long process, and you're going to have good days and bad days. And the key is to make sure that those bad days really don't get you down. That's okay. That's part of the process. Don't get too high with the good days. Don't get too low with the bad days. It's all part of the process, and you're going to do fine if you keep on track. Now, part of your post-op recovery includes giving you a blood thinner for 6 weeks after surgery. If you were on blood thinners before surgery, chances are we're just maintaining that at this stage. But if you weren't on blood thinners before surgery, you're going to continue the blood thinners we gave you during your stay at the hospital for a full 6 weeks. Whether it be aspirin or Coumadin or something else, you're going to make sure you take those blood thinners for a full 6 weeks because that's the time period of the highest risk for blood clots. So be on top of that. Now, speaking of 6 weeks after surgery, that's when we see you again, 4 weeks from now at 6 weeks from surgery. And at that appointment, we get x-rays to show you your knee replacement, and we check your motion to make sure your motion is as good as we'd expect it to be at that stage. But of course, 6 weeks from surgery, 4 weeks from now is kind of a long time, and you might develop questions or concerns between now and then. We want you to call us. That's what we're here for. We're a team with this. I don't want you to be worried or anxious about your knee. If there's any issues, any concerns, anytime, please call us. Otherwise, keep working hard. Don't let the highs get too high. Don't let the lows get too low. And we'll see you again in a month. Thanks for watching.